I'm Philip Mason Joyner, one of the incident commanders here at Clackamas County's Emergency Operations Center and a local public health official. Today is April 3rd, and the Operations Center is fully activated, working to protect your health and the health of our community. Currently, the state of Oregon has 826 cases of COVID-19. There are 61 cases here in Clackamas County, and 3 of our residents sadly have died from this virus. On a lighter note, in the past 24 hours, I'm really happy to share that we have received our first delivery from the state and federal government of personal protective equipment. And this equipment is for our healthcare providers and first responders. We recognize though that this first shipment is not nearly enough to meet all of the different needs that our county has. One way you can help is by donating personal protective equipment. You can donate unused medical masks, gowns, gloves, and face shields by emailing eoclogistics@clackamas.us or calling 503-650-3312. We also have a brand new web-based form. It's available on the county's website. And so if you go to clackamas.us, there's a red banner at the top for updates on COVID-19, and that web page will provide you with all the information you need to complete that form. I also want to clarify that yes, we are accepting homemade masks. While these currently aren't being used within that healthcare setting, these still are really valuable. We have a lot of needs, specifically for our social service providers and others that are providing essential services during this time. A good example is our volunteers that are working to prepare food boxes and get those delivered to our most vulnerable populations that can't go to the grocery store and can't access food very easily to keep them healthy. Your donations, they will be put to good use, and they will be greatly appreciated. I also want to thank those organizations and partners and residents that have already donated to us. We appreciate you so much and your willingness to help the county. Right now, the projections, they're looking pretty promising for Oregon, although if you're watching the news, much worse overall for the United States. We're closely monitoring that. The number of cases in Oregon, it's expected to peak around May 5th or around that week. And we're anticipating really busy hospitals, but hopefully no shortage of hospital beds. This projection, it's only going to really hold true if we can continue to stay home and limit our time out in public spaces, really limiting our trips for only when we have to do essential tasks to take care of our families. And I want to close by letting you know that we've heard and received quite a bit of requests for us to share more local or city level information about cases. We understand the interest in this and the concerns, but because we only have 64 cases countywide at this time, we're not going to be reporting more granular data, at least right now. That could change depending on how we move forward with this crisis. It's really important to remember that there's evidence of spread of COVID-19 across all our communities, and universal precautions should be followed wherever you live and at all times. If you come into close contact with someone that is a confirmed case, the Clackamas County Public Health Division will be contacting you. We are all at risk of this disease. We're all at risk of potentially becoming sick and potentially passing this illness to others. The best thing you can do is physically distance yourself from others, but find new ways to stay socially connected with your family, with your friends. It's a challenging time for everyone. I hope you're all staying safe. I hope you're all being well. And thank you so much for continuing to help your community and to protect others.